Hi, I'm Dr. Tipu Khan. I'm the medical director for our backpack medicine project. I'm boarded in family medicine. I'm also board certified in addiction medicine. I'm our county's addiction medicine consult chair. I run our inpatient and outpatient service. And I also run our backpack medicine project. The backpack medicine project is a very interesting group of individuals that came together about 2 years ago. And it started with the impetus of understanding there was a need for our patients that wasn't being met. As a county facility, we are a safety net hospital, so we take care of a lot of the underserved, a lot of the homeless. And what we found is a lot of these patients were disconnected from their clinics. So they were making it into the hospital when they were really, really sick, but they weren't making it into the clinic when they weren't really sick and when we could have intervened and prevented this illness from becoming a bigger deal. So one of the thoughts we had was, hey, what if we get out to the patients, meet them where they are, and provide some basic medical care, and try to help stabilize some of their medical conditions. And that was the impetus for starting the Backpack Medicine Project.
Hi, my name is James Boyd. I'm the program assistant for Healthcare for the Homeless and One Stop program. We started Backpack Medicine about 2 years ago. And so what we did is with the plan for the program was to bring doctors out, and we go out into the river bottoms and streets, parks, things of that nature, and provide services.
One of the very unique aspects of our backpack medicine and street medicine team is that we're a multidisciplinary team. So we come with not just a physician and a nurse, but also a myriad of services. We have services such as behavioral health, they're there with us, alcohol, drug treatment counselors, we have addiction specialists that come out with us. We have public health doing screening for STIs that are out with us. And we have social workers, and we also come with whole person care, which really is a great resource for our patients. A lot of these patients are high utilizers of multiple systems throughout the county because of their unstable situation. So we've got case management through whole person care, really trying to connect the dots for these patients and helping alleviate some of these social determinants of health that they might be dealing with.
The reason a lot of these clients that we run into out in the river bottoms and outbacks and things of that nature, why they do not access your traditional healthcare systems as far as clinics and things of that nature is due to lack of transportation, also lack in trust in the system, and maybe they were done wrong at some kind of level in some kind of clinic. And so our goal is to go out and re-engage these individuals, get them trusting in the process, get them trusted in the system so we can get them back into clinics. The goal would be to build trust, build awareness, cut down ER visits from these particular population.
A common thing that we deal with a lot when we're down there in the river bottom and in our homeless encampments is substance use. So these patients oftentimes are struggling with substance use disorders, and the big one that we're trying to see if we can intervene on right now, which is part of the nationwide epidemic, is opiate use disorder. So one of the services that we require all of our doctors that go out on this project with us is to be able to provide medication-assisted treatment. And for our team, it's also very rewarding, and it's a good community outreach for our residents who are doctors in training.
Hi, my name is Hannah Edmondson. I am a public health nurse for Ventura County. I work in the communicable disease program. Part of my job is to follow up on patients with sexually transmitted diseases, as well as any other infectious diseases that are reported. Part of my experiences with the backpack medicine is I get to go out and I get to meet people and I get to provide care and outreach to people who may be at a greater risk for syphilis, for HIV, and also to other communicable or infectious diseases, for example, Shigella or hepatitis A. These are diseases that can be spread by unsanitary or difficult ways to have hand washing. If you have limited or no access to fresh water for hand washing, and toilet facilities, limited or no access for toilet facilities. These are ways that some of these diseases can spread in these group settings. We are able to provide screening. I provide vaccinations for hepatitis A as well as tetanus. We're able to kind of get a feel in the community if anybody has any kinds of signs or symptoms that might tell us that there's something going on that we need to further investigate.
Hi, my name is Jason Velk. I'm a deputy with the Ventura County Sheriff's Department. I work at the Ojai Police Station. Law enforcement and the backpack medicine have been working together for approximately a year and a half now. It gives us the opportunity to provide resources to the homeless population of the Ojai Valley that wouldn't necessarily reach out for those resources. It gives law enforcement the opportunity to contact the homeless people and form positive relationships with them, which aids to good community policing practices.
From the patient perspective, backpack medicine really brings a unique healthcare delivery model to them. We really push this concept of patient-centered medical home. And on the flip side, for us as a system, it helps us understand the needs of our most vulnerable population. These patients oftentimes are hard to get a hold of. We don't know much about them until they show up in the emergency department really, really sick. So this gives us an opportunity to get down there, get to know who they are, what they're struggling with, and help us kind of figure out what we can deliver to them to minimize some of these hurdles they have to jump over to get adequate care.